Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for Tuesday, September the 21st for this week. It's my honor to be here on the territories of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nations. This is for everyone on the phone, everyone in the media. We will be doing a significant presentation. Dr. Henry will be in an update with slides today, and so the presentations may go about half an hour in total, a little more than that, and we are committed to providing ample time for questions after that. So ask everyone to be patient, and we've got some significant items to cover today, and it's my honor now to introduce Dr. Bonnie Henry.
Thank you very much, and good afternoon. So today I'm going to provide a few updates on our ongoing public health response. So there's some aspects around vaccination, and then there's some aspects around schools. So as Minister Dix has indicated, there's quite a few things that we want to cover today. But to start with, I want to talk a little bit about some of the information that we have on how well vaccines are working in our community and updates on boosters. So to start with, let's see if we can get our presentation to go. There we go. Okay. A couple of weeks ago, I had announced that clinically extremely vulnerable individuals with certain immune compromising conditions will be offered a third dose to complete their series. And that has started already to gain an increased immune response in people whose immune response doesn't respond as well as most people's. One of the things that has helped us in understanding who needs an additional dose or not of vaccine is the vaccine effectiveness work that's been led by Dr. Danuta Skowronski out of the BC CDC, and we have an update on that now. And in this slide, there's a lot of information there, but really what it tells us is that lots of people, as we know, over 7 million doses of vaccine has been given in British Columbia, and there continues to be ongoing monitoring and assessment of our effectiveness in communities across BC. What this tells us quite clearly is that for the majority of people, 2 doses of any vaccine, no matter what combination you received, has been shown to be highly effective and continues to be protective against both infection and hospitalization across BC. So this is good news, and it also includes the period of time where the Delta variant has been the majority of cases that have caused illness here in BC. So we look at the top left hand of this schematic, and you can see the numbers of people we're talking about. The majority of people in British Columbia received 2 doses of the Pfizer mRNA vaccine, 2 doses of Moderna was second. There are some people who received AstraZeneca and an mRNA mix, and about 3% of people received 2 doses of AstraZeneca or Covishield, and about 5% of people received AstraZeneca and an mRNA. So what we show on the right-hand side and the blue lines is that with all of these combinations across the age groups in British Columbia in community-dwelling adults, so these are not including people in long-term care, we have in the high 90s protection against infection, that is even against the Delta variant, with a slightly decreased protection, about 80% with the people who received 2 doses of AstraZeneca, but across the board, high 90% protection against severe illness. That means hospitalizations with all of the combinations that we have. This is important, and it's good news. It tells us that whether you got 2 doses of AstraZeneca, whether you got a combination of Pfizer, Moderna, Moderna, Pfizer, AstraZeneca, Moderna, AstraZeneca, Pfizer, you are well protected. And that's important information. I know there's a lot of concern about acceptance of mixed vaccine schedules around the world. We continue to work with our colleagues in Health Canada and internationally to make sure that these mixed vaccine schedules are going to be accepted, and we ask for people to be patient on that. The other information that we know is that this protection is lasting now. We have data that shows that out to 4 months, we still have strong protection from all of these vaccine combinations for people, adults in the community. Finally, we also show that protection, one of the key decisions that we made early on was about the interval between dose 1 and dose 2, and how do we protect as many people as possible, as quickly as possible, given the vaccine supply that we have. So what the data is now showing is that decision that we made quite early on to extend that interval has led to stronger and longer lasting protection in our community. So this also is really good news, and it separates us from some other communities that have used more shortened schedules. Having seen this, however, we do know that the people we prioritize first to receive vaccine are our elders and seniors in long-term care and assisted living. And we know that older people have less strong immune responses to most vaccines, and although these ones are really good, we do know that it may not be as high as others. We've also seen in these congregate settings, even when we have most of the residents fully immunized, if this virus is introduced into those settings, there is a significant number of people who will have breakthrough infections, and this in an elderly population can be lethal. As a result, these people were the first people to receive vaccine, and many of them received it at a smaller interval. We've been looking at the data on when is the best time to provide a booster dose, and we've made the decision that we will be providing a booster dose for our elders and seniors in long-term care and assisted living. And the data that's come out shows that somewhere around 6 months is probably, after dose 2, is probably the best time to do that. So starting next week, we will be providing a booster dose for residents of long-term care and assisted living. We know that our seniors and elders have carried a heavy burden, and we continue to see cases in these homes. We are going to do this as well in conjunction with providing them with protection against influenza. And again, this year we'll have the high-dose influenza vaccine, and our immunization teams around the province are preparing to be able to provide both the booster dose of COVID and the influenza vaccine to our seniors and elders in care in the next week or two, starting in the next week or two. So I think that's important news for all of us. I want to address as well some of the additional actions we are taking as part of our public health response, in particular in our schools. But before I do that, I want to address as well how we report hospitalization data, as there seems to be some misinformation or confusion about what and how we report. There are 2 key hospitalization metrics that we have used all along. The first relates to an individual's COVID story. So, as you know, whether you have COVID in the community, whether you're somebody who was infected while you were in hospital for something else, we report all active cases. So when somebody is diagnosed with COVID in the community, we consider them active cases for 10 days because most people are no longer infectious to others. So you're no longer an active case after 10 days. And for most people, that's the period of time that they've recovered from their acute illness. We know that many people are recovering in the community, and it takes for some many weeks or months longer. But they're no longer an active case in our statistics. And those are the cases that we report in our daily reports and in our weekly surveillance reports. The other reason we track is if somebody who is a case, whether they're infected in the community or in hospital, when they have an active COVID case and they are in hospital, we count them as a hospitalized case, and that's reported in our weekly surveillance report. But it's only counted once when somebody's in hospital. For the period of time that they're in hospital, they may go into ICU for a period of time, they may come back and forth, and so those daily numbers of people in ICU reflect a variety of things. They reflect people going, you may be in hospital twice and you may go back and forth to ICU, depending on how severe your illness is. When somebody has recovered from their acute illness, their active infection with COVID-19, some people still need ongoing hospital care. So they really are what we call recovered in hospital, but they're no longer one of our active cases. So they're no longer reported in our active surveillance reports as somebody who is hospitalized or needing ICU care. But they've already been in those statistics. It helps us understand the picture of how many people, what percentage of people at different age groups with different underlying conditions need hospitalization, need critical care. So even though they are no longer considered an active case because they have recovered from their acute COVID illness, they are still included as a COVID case recovering in hospital. And those are the statistics that the minister has been reporting on a regular basis with our hospital cases and our people in ICU. Hospitals continue to monitor these available beds. It helps us understand capacity, infection control, etc. So if someone comes into the hospital with COVID, the record shows them as a person with COVID. It's on the discharge abstract, and it is a metric that we follow over time, even though it's not on the acute illness and the weekly surveillance reports. So we will start to include this. It's a small number of people who need to be in hospital over a period of recover in hospital over time, and that number fluctuates over time. There are still somewhere around 140 people over the last little while that are recovering in hospital after their acute illness. They're no longer an active case. Most of them, the vast majority of them, are in a medical bed, so they're not somebody who's in an ICU bed at this point. And we're going to be incorporating that metric into our weekly surveillance reports to give people an idea of the impact of this virus. So while some people are recovering at home after they're no longer an active case, there are also people who are recovering in hospital. And those are metrics that we'll be sharing with people. Right now, I also want to give an update on what we are seeing in children and youth cases of COVID-19. Oops. The data I'm sharing it compares what we've seen across the pandemic since January of 2020 and compares it to what we're seeing up to September 23rd, so in this last week. What we have seen in the far right is by age group. We've broken it down by children 0 to 4, 5 to 11, and 12 to 17. We have seen an increase in numbers of children in each of those age groups who have been diagnosed with COVID-19 in the last week, compared to what we've been seeing over the course of the pandemic. We're also watching very carefully markers of more severe illness like hospitalization, critical care, and sadly deaths. So we have seen 2 cases in the 0 to 4 age group who've been hospitalized, and 1 child each in 5 to 11 and 12 to 17 who've needed to have hospital care in the last week. And we have a single child in the 0 to 4 age group who's required critical care in that period of time. Thankfully, we have had no deaths. We've had 2, as you know, sadly, young people who've died, an infant and a toddler who died last year from COVID-19. We've not seen any deaths in school-age children, and we hope that that will continue. So what we are seeing, of course, is that this is in children who are unvaccinated, as well as the youth 12 to 17, and it is a concerning trend. This is why it is so important for all of us to pay attention to this. The rates that we're seeing right now of COVID-19 per 100,000 population is going up quite dramatically, particularly in those younger school-age children who are not yet eligible for vaccination. It has gone up but leveled off in the 12 to 17-year age group, you can see, as other age groups are coming down. But this reflects, of course, the regions of where we're seeing transmission. So we need to break this down and try and understand who's being affected and where. When we look at the testing for COVID-19 across the age groups, what we've seen is a dramatic increase in numbers of children, particularly school-age children, who are being tested for COVID-19 in the past 3 weeks since school started again. And that is something that we expected. We saw that last year as well. So we've gone up from about 100 children a day being tested across the age groups to over 500 children a day being tested for COVID-19. So that's important. That tells us that we're seeing children, school-age children, having illness that leads them to be tested, and that the testing has gone up quite dramatically. But the test positivity has stayed lower or gone down in most cases. And the one area that we're seeing that is still high is children age 5 to 11, where it's around 5 to 10%. It's somewhere in that range of those children who are tested. So that means that the case numbers are going up in that age group in particular. We are seeing it come down. Even though testing is going up, the percent positivity is decreasing in older children who are protected through vaccination and in the 0 to 4-year-old age group. So what does this mean? Where are those children who are testing positive for COVID right now? This is just breaking it down once again to show the dramatic increase in numbers of children being tested and the test positivity rates that we're seeing in the different age groups. So if we break it down again, and this is kind of a complicated slide, so we look at each column is the different age groups 0 to 4, and those are the children who are not in school, who don't wear masks and are not eligible for vaccination. Then we have the school-age children, and the 12 to 17, as we know, are in school, where they are wearing masks and are eligible for vaccination, and then the two groups in the middle where mask mandates are more or less required, but they're not yet eligible for vaccination. And if we look by geography, it tells us that case rates in school-age children and in younger children and older children were increasing prior to school starting in both interior and the northern health regions. And this reflects the vaccination rates in those communities and the fact that we're seeing transmission of the virus in those communities. And that, of course, affects families and affects children. And that has been translated into children in school settings as well who have been tested positive for COVID. We see that if we look, though, in areas where community vaccination rates are higher, and particularly in Vancouver Coastal and in the island, we see that the rates in school-age children stay low and steady. We have seen an increase in some focal areas, particularly in Fraser Health and one part of Island Health. So we need to break this down a little more to understand exactly who's being affected. So if we look at the different communities within the regional health authorities, we can see that most of the children that are testing positive, this is children age 5 to 11-year-olds, are in the Fraser East region. And this is the area of Fraser Health where we have the lowest immunization rates in many communities and where we're starting to see as well cases take off in adults and other age groups in that community. And I'll have more to say about that in a few minutes. We also see that in parts of the interior where we have lower immunization rates, again, we're seeing children, school-age children being affected. And we look at Vancouver Island. We have very high testing rates in North Vancouver Island, Central Vancouver Island, and we did see an increase, though that's leveling off now, in the percent positive in these school-age children who are not yet eligible for vaccination. So this tells us quite a lot. It tells us that the rates that we're seeing in school-age children who are reflected in the rates of vaccination that we're seeing in the community. But it is important for us to continue to watch this and to pay attention to make sure that we're not seeing more severe illness as well. And it's important for us to look at this in the context of who is vaccinated. And across all age groups, we see that those who are not yet vaccinated have a much higher rate of infection than people who are protected through the immunization that we have. And of all of the unvaccinated populations, the case rate is less in the 0 to 11-year-old age group. So that puts it in some perspective for us. And it really tells us the measure of how important immunization is and how immunization protects those who are not yet able to be vaccinated. As I mentioned, it's important for us to continue to watch this, to pay attention to who's getting infected and where, and to make sure we understand if we're seeing increases in hospitalizations or deaths. And this thankfully shows us that we're not seeing that in children across the board right now, but we need to make sure that that doesn't happen. And how do we do that? We do that by making sure that all of us around those children are vaccinated so that we can protect them. As I mentioned last week, I committed to updating our school notification approach because we know that it wasn't meeting the needs of the school communities. So as of today, the regional health authorities will start posting K-12 school potential exposure events on their websites. And there will be a link at the BC CDC website for all of the regional health authorities. This is similar to what we did last year. What we aren't going to be able to do this year and what was not effective in terms of spreading information or supporting transmission or decreasing transmission in schools was sending out a letter to all of the schools if there was an exposure event. We will be posting this if there was somebody who attended school while they were infectious and there was a possibility of transmission to others. Most cases, this will be others in the classroom. And these will be posted as the health authority identifies them. The reality that we know is it takes time. It takes time for public health to be notified of a positive lab test and to do that important case investigation to understand what settings people were in, where they could have picked this up, and where they could potentially transmit it to others. Also, right now, we know that the risk to people who are vaccinated is much, much less than the risk to those who are unvaccinated. So we take that into account as well when we're talking about a school setting. So as it was last year, we know that these postings will lag behind certain parent postings, and parents get information directly. If one of their children tests positive, they get often a text from the lab. So them sharing that information is something that is helpful to some communities, but what we will have is an authoritative source where people can go to find out if there has been exposure events at their school. It remains critical, though, that parents monitor their health daily. We have many things in place in schools across the province to try and prevent transmission and keep it as low a risk environment as possible. And I know that our MHOs are working with the schools across the province to make sure that those are in place and that we're following them. So one of the important ones is the daily health check for all school staff and for children. What we are seeing now in the province, as we're seeing across the country, is that there are other respiratory viruses that are starting to circulate in ways that we didn't see a lot last year. And that's because we're more mobile now, both within the country and internationally. So we are seeing, of those 500 children a day who are being tested, many of them are testing positive for the cold viruses like enteroviruses and adenoviruses. Some of them are getting para-influenza. We have not yet seen influenza, but we are on the lookout for that, as well as RSV, which can cause a very severe respiratory illness in children as well. So these are important things to know right now. We are seeing colds and flus going through our school-age children. Some of it is COVID, and we do need to continue to test and continue to monitor and to keep children home if they're not feeling well right now. And that means flexibility. It means flexibility in our school community and flexibility in our workplace and our community. And what we are seeing very clearly from these data and from what we know, the experience in schools, is the trajectory and the level of cases among school-age children reflects our overall community vaccination rates. So it's protection in our community that protects our schools and protects our children. And the best way to prevent COVID from getting into our schools is for everyone eligible, whether it's an older sibling, a parent, school staff, to be vaccinated. That protects you, and it protects your community too. as indicated, we have seen a notable rise in cases in schools, in the broader community, in the Eastern Fraser Valley. As a result, there is a new regional public health order that will be in place in Fraser East local health area that will come into effect today. And this order will be similar to the approach that we took in interior health in the north, where we addressed decreased rates of immunization and increased rates of transmission on a regional basis now. This includes the communities of Hope, Chilliwack, Abbotsford, Mission, and Agassiz-Harrison. And we had the opportunity to speak to some of the leaders in those communities earlier today to make sure they understand how we can work together to try and address the issues that we're seeing, and that is increased numbers of people becoming ill with COVID, particularly people who are not yet vaccinated. And that is now putting a strain on our hospitals, whether it's the Chilliwack Hospital that just had an outbreak, the Abbotsford Hospital, and the hospitals across Fraser Health, which means that not only are people with COVID having challenges and stressing in our ICUs, but people with other conditions are having surgeries postponed or not able to get the care they need. So we need to take action now to increase vaccination rates and to reduce the transmission rates in those high-risk settings in our community. So as of today, the order will require that private gatherings will be limited, so that's not household gatherings, limited to 5 additional people or 1 additional household, so keeping our bubbles small again. And 10 people outdoors, unless all of the participants are fully vaccinated. So this is where we know that if we are coming together, particularly indoors, where this transmission can happen very quickly and rapidly with the Delta virus that we're seeing transmitted right now, we can mitigate that by being fully vaccinated. All the organized events, such as weddings or conferences, will be limited to 10 people inside or 50 people outside, unless all participants are fully vaccinated. And this is where the BC vaccine card will become important. For organized events, that is your proof of having full vaccination. So for the rest of the BC vaccine program, that vaccine card 2-dose is will be required by October 26th. We're moving that up in the Fraser East region to address what we're seeing right now, which is transmission between vaccinated and unvaccinated people in these organized settings. All ticketed events, including movies and plays and ticketed sports events, will only be able to admit fully vaccinated individuals. All indoor adult sports, exercise and fitness, including gyms and high and low intensity fitness, again, will require people to be fully vaccinated to participate. Outdoor adult sports will be limited to 50 participants, again, unless all of the participants are fully vaccinated. In addition, events must keep a contact list of guests in addition to having their COVID safety plans in place. One of the other areas in Fraser East that has been concerning has been transmission in indoor workplaces, and we'll be stepping up the need for a COVID safety plan and include the requirement that masks must be worn in all indoor workplaces, subject to some exemptions and safety considerations, unless people are behind a barrier, in a room by themselves, or able to maintain a safe physical distance. So these are additional measures that we're taking in the community in Fraser East to address the challenges that we're seeing in that community right now. I have shared a lot of updates, both about the immunization program, also about our response to the pandemic here in BC today. As we have seen for many, many months now, this pandemic continues to evolve, and so do we. We need to make changes to address the situation as it is arising. What remains steadfast is the need for all of us to do our part to protect ourselves, our families, but also our communities. And now we're seeing in some parts of the province, in the interior, in the north, in Fraser East in particular, our communities are being affected too. This means we all need to get vaccinated, to stay home, to stay away from others if we're not feeling well ourselves, to continue to take those basic measures, wearing a mask when we're indoor public settings, cleaning our hands regularly. These are things that will be important for all of us to get through this next respiratory season. This virus has changed. We know it is being transmitted more rapidly, particularly to those who don't have the protection that vaccination offers. Part of what we do to protect our own community, to be part of our own community, is making sure we're making the choices that are in the best interest of all of us. To protect those who are more vulnerable, people whose immune systems cannot respond to the vaccine, and particularly children who are not yet eligible for vaccination. These are the things that we do together in this storm that has been going on for a long time. These are the things that we need to continue to do. And as we said for many, many months now, these are the things that we do for those we love and for those we don't know. And we need to continue to do this with the compassion and kindness that we've shown all along. Thank you.
Thank you very much, Dr. Henry. I have a number of updates as well, and as noted, we will be leaving significant time for questions as well. Updates on three subjects, essentially the contact tracing capacity to meet needs in all regions of British Columbia, updates on vaccinations, and updates in a third category, which is surgery, ICU capacity, and overall capacity in our hospitals, and some updates on that issue. I want to start very quickly with contact tracing. As you remember, in Wave 3, we had well over 10,000 active cases. That number went down to under 1,000 in the early part of the summer, and has now increased. We've had in recent reports around 6,000 active cases. Over the summer, as those numbers declined, some contact tracers were redeployed to support vaccination or other public health efforts, and others returned to their base positions, including acute care and other areas that needed support in the health system. Health authorities, of course, maintain records of who is trained and potentially able to be redeployed back into contact tracing roles as needed, and in some cases have worked their way through the list. Today, the total number of contact tracers in the province is 1,164, which is a significant number, as you can imagine, with an additional 147 planned. And we'll be reporting on these numbers every Tuesday so that you'll have a continuing baseline of where we are in terms of contact tracing. But I think the decisions that were made to increase and significantly increase our contact tracing capacity in August of September 2020 continue to give us the means to respond to this very challenging pandemic and to support people who test positive for COVID-19, which is for every single person who tests positive an anxious time. With respect to vaccinations, more than 4,064,859 British Columbians have now received their first dose of a COVID-19 vaccine. That's as of end of day Sunday. That's 87.7% of eligible people, 12 plus in BC, which is a significant achievement and comparable and as good as any area in the world. 80.5% are fully vaccinated, meaning they've received 2 doses of a COVID-19 vaccine. For adults, those 18 and above, those numbers are 88.2% first dose and 81.3% fully vaccinated. So we continue to make progress. But as you're aware, there's areas of the province that are seeing higher case counts, and this is in large part due to lower vaccination rates in these communities. Dr. Henry announced some measures in Fraser East, the Fraser East Health Service Delivery Area. And for those members of the media who want to know where they apply, it's the Fraser East Health Service Delivery Area, and you can Google that and get a map from the Ministry of Health. That includes the communities of large communities such as Hope and Chilliwack, Abbotsford and Mission and Harrison Hot Springs. And what you see in Fraser East, well, some areas and some community health service areas within Fraser East have relatively high vaccination rates, including a significant one in Abbotsford, which is at 88%. Overall, vaccination rates in Fraser East are significantly below those in the other 2 health service delivery areas in Fraser Health, Fraser North, which is the suburbs of Tri-Cities, Burnaby, out through Maple Ridge, Fraser South, which is Surrey and Langley and Delta, and other communities in that region. So what you see is, and what we've seen is in some areas of Fraser East, and I'll just note these in passing, a relatively lower level of immunization. Thus, in Mission, for example, it's under 80% in both Mission North and Mission South. In Chilliwack North, it's significantly below that in first dose vaccination rate, and we simply have to raise those vaccination rates higher than that. Across Fraser Health, the number is 88.5% first dose and 81.3% second dose, so we've done very well across Fraser Health, but we have to focus in on these areas, and I encourage everyone living in Fraser East to get vaccinated for their communities, for their children, for their elders, for everybody. Getting vaccinated is the important thing to do. We have measures now in place in Fraser East, continue to have measures in place in Interior Health and Northern Health, which we're also seeing in a pandemic that's become a pandemic of the unvaccinated to a large extent, that in such a pandemic, the importance of immunization is there. And I want to again express my appreciation to members of the opposition. I'll be joined this evening in a town hall format this evening with the Leader of the Opposition Health critic Shirley Bond, Dr. Henry and myself to answer people's questions in the Northern Health Authority. Simply put, we need more people to get immunized. We need to continue to push this. We have to have an excellent record. Our teams have done an exceptional job. The vast majority of British Columbians over 12 have been immunized, 87.7%, and yet we need to continue to do better. And you see that in the numbers. You see it in the numbers where we have about 142 people or 141 people in ICU today, and the vast majority of those are unvaccinated, and only a small number of them, 8.5%. When we think of that, more than 80% of the population fully vaccinated, only 8.5% of COVID-19 patients in ICU are fully vaccinated. The way to stay safe, the way for your family to stay safe, the way for your community to stay safe is to get vaccinated. I want to take you through some of the other significant numbers with respect to surgery, with respect to capacity in our healthcare system. I've, as you know, been reporting on these issues consistently, and we'll do so every Tuesday. We have, just to review, in our base beds in our overall healthcare system, our total hospital occupancy, 9,218 base beds in BC, and a further 2,040 surge beds, leaving an overall capacity of 11,571. Of our base beds, as of today, 8,614 of those beds are filled, leaving 604 vacant base beds, for a base bed occupancy rate of 93.4%. Put that in context, of course, we were running over 100% in the period prior to the COVID-19 pandemic. For example, on March the 9th, 2020, that nonetheless, given the circumstances of COVID-19 and the pressure on our healthcare system, is a significantly and a high base bed occupancy. Still, with respect to our surge beds, the occupancy rate is 13.3%, meaning that we have 2,353 surge beds, and 2,040 of those are vacant, meaning there are 313 of those surge beds that are full. So in total, that's 8,971 people in hospital in British Columbia as of today. In terms of our critical care capacity, that critical care capacity, we have 510 base critical care beds. We have a further 218 surge beds. You see these numbers in Alberta where they've combined the two right now. This is our total, which is 728 is our critical care occupancy. Of the 510 base beds today, 425 of those base beds are full, and a further 28 of the surge beds, of the 218 surge beds, are also full. So the total critical care occupancy today is 453 in total out of 728 total beds, but our base bed, remember, our base bed complement is 510. Again, I want to remind everyone of the full picture, that COVID-19 is being felt differently in different regions of BC, and we are continuing to take steps to support hospitals that are facing real challenges of over 100% capacity and significant amount of COVID-19. Hospitals in Interior Health, for example, such as Royal Inland in Kelowna. But in particular, we've been taking steps to support the Northern Health Authority by transferring critical care patients and ensuring that the Northern Health System, which is facing the highest levels per capita of COVID-19 right now, are sustained. Last week, I reported that 12 patients had been transferred, critical care patients from the Northern Health Authority to either the Island Health Authority, the Vancouver Coastal Health Authority, or the Fraser Health Authority. That number, the total number as of today, that 12, there have been an additional 13 for a total of 25 patients have been transferred. This shows our determination to support people in the North and the challenges that they're facing with both low vaccination rates and high case counts for COVID-19. I want to again recognize the exceptional work of our doctors, of our nurses, of our health sciences professionals, of our healthcare workers across Northern Health, and say that, yes, we are providing additional supports, and we will continue to, from BC CDC to support vaccination, from BC CDC to support contact tracing, and to relieve pressure on acute care capacity at our northern hospitals. Our teams are doing a fantastic job under very challenging circumstances. We all of us, everyone in BC, and I know everyone in the North, is very proud of them. And what we can do to help those teams is to get vaccinated as soon as possible. We see this, and we see this pressure point, which is the significant number of patients who've been transferred with COVID-19 are unvaccinated, and a significant number of people are unvaccinated in the North. And you can see this, the difference between, in a per capita sense, between an 87.5%, which is around the provincial average, vaccination rate, meaning 12.5% unvaccinated, and a 75% rate, or 25%, is twice as many per capita of unvaccinated people. And in a pandemic of the unvaccinated, that makes everyone and puts everyone at risk. Last week I reported that because of increasing COVID pressures, and we have over the last number of weeks, we have reduced non-urgent scheduled surgeries in several health authorities. The pressure on hospitals persist, and surgeries do continue to be postponed. Our surgical renewal commitment to patients has not changed. You are not forgotten. You will not be forgotten. You will be called again. We will reschedule your surgery, and we will make sure that that surgery happens. However, all of our hospitals across British Columbia and different communities have had to postpone surgeries. In the week from September 19th to September 25th, 344 non-urgent surgeries were postponed. That's 45 in Fraser Health, 99 in Interior Health, 11 in Northern Health, 63 in Vancouver Coastal Health, 127 in Vancouver Island Health. No surgeries were postponed in the Provincial Health Services Authority. So cumulatively, from September 5th to September 25th, there have been 1,143 surgical postponements. From September 5th to September 11th, which is our latest reporting period, health authorities report that 5,302 surgeries were completed. So enormous work is continuing to happen in both scheduled and emergent surgeries in all health authorities. That week, of course, the 5,302 refers to the week that included Labor Day, so there was essentially one less full day of surgeries. It nonetheless shows the continuing efforts of everyone to, in these challenging times, to continue to make sure people get the care that they need. But I encourage everyone, for all of those people you know, or anyone you may think of who's having a surgery delayed, that the answer for all of us, we have agency, we have power, and that is to get vaccinated. COVID-19 is a determined virus. The Delta variant is testing us all, and the impacts on our healthcare system, as I've reported here today, are significant. Pushing back this fourth wave of the Delta variant is a formidable test of our determination too, and we need to continue to do it. The message is, get vaccinated, follow public health orders, use our COVID sense. COVID-19 is a virus that counts on our vulnerabilities and pounces on our slip-ups. And as so many are being forced, it's a virus that embraces the denials and envelops the disbelief of those who choose to stand in its way, unprotected by vaccine or use of COVID sense. The actions announced today in communities with higher transmission, taking even greater care on the side of caution, will see us again push back the virus that spreads to live and wreaks so much destruction as it does so. Thank you very much. We're happy to take your questions.
Thank you, Minister. A reminder to media on the line that you may now press star 1 to enter the queue. You'll be limited to one question and one follow-up today. Please also remember to take your phone off mute, as you will not be audible until your name is called. Our first question today comes from Richard Zussman with Global News. Richard, please go ahead.
So the Vancouver School Board has decided to make masks mandatory for those kindergarten to grade 3. CDC report out of the United States showed that schools that do not have a mask mandate from K to 12 are 3.5 times more likely to have COVID cases, or have COVID cases at 3.5 times a higher rate than those that do have a policy in place. Why will British Columbia not put in place a province-wide mask mandate for students K to 12?
Yeah, so as you know, we do have a mask mandate in our schools, and I think you can't directly compare the report that came out of the CDC that looked at communities and schools without mask mandates and a number of other factors that are protective factors. So I think it is really important to remember that we still have many layers of protection in place in our schools, and masking is one of those layers. We talked about it today, how important it is to monitor every day, that daily symptom check, the fact that we are, while we don't have the same concept of cohorts as last year, there are limitations in intermingling between classes in different grades. Those are important factors. The ventilation that we've been paying attention to, the way classes are situated. And of course, we have to remember as well the before and after school mixing that happens in school-age children. So all of these things are important. And, you know, I showed the data today. We are seeing increased cases in school-age children. That means that school-age children, some of them will be coming to school with COVID. We know that the things that we need to have in place in schools to prevent transmission in the school setting are myriad. And I have tasked, as I said, our school team that works together. They meet 2 to 3 times a week to look at every individual situation, and particularly look at those communities where we have higher transmission rates and lower vaccination rates, to see what we need to do in the province to make sure we can make schools continue to operate safely.
Richard, do you have a follow-up?
Do we have any sense of how many of these cases among children are connected to parents who are not immunized? And on another topic, what is British Columbia planning on doing for a third dose potentially for those who have mix and match or AstraZeneca and may have problems traveling? There are a number of people, I'm sure you've seen the emails, concerned about limitations of where they can go based on what vaccine they have received. Is British Columbia going to provide an additional dose so that people can more freely travel based on international guidelines? Yeah,
so in terms of school cases and children, the cases that we're seeing are much more likely to be from families where adults in the family are not yet immunized, or to be exposed in settings where there are older children or adults that are not yet immunized. So yes, it is important. We see in the data I showed today, it shows you on an even a bit of a community level where vaccination rates are low, rates in children and rates in adults are higher. So that's important, and the most important thing we can do to protect our schools until we have vaccination for all school-age children, and we're preparing for that as soon as we can, is to make sure that all of the adults and the older children in those settings are protected. In terms of the vaccine mix and match schedules, and whether it's Pfizer, Moderna, Pfizer, or AstraZeneca, these things are in flux around the world. So no, we're not systematically requiring or providing people with a third dose because we know that these are changing. We know that the U.S. regulations are changing, and it's not that people are prohibited from traveling, it's that they may have restrictions on the things they can do when they travel. And those are things that we are working very hard across the country, but also with our counterparts at WHO, with the U.S., the CDC, to make sure that the evidence that I showed today of how effective these schedules are and how protective these schedules are gets shared forward internationally and leads to us having a more harmonized approach to how we allow immunization schedules to be used as proof of vaccination around the world. So these things are changing. They're changing sometimes day by day. We know that. And what we need to do is continue to be protected in where we are here. And we're not systematically providing a third dose for people just because of their desire for international travel.
Our next question is from Caden Fanshawe with CKPG. Caden, please go ahead.
Thanks so much for taking my question today. I just wanted to ask about the wait to get a COVID test, particularly here in Northern Health and in Prince George. Hearing from parents of kids at schools that have tested positive, they've been phoning the line to try and get through to book a COVID appointment test, but couldn't get through or have been faced to wait days to get one. And they're going to walk-in clinics to get these tests and not a testing center itself. Is that acceptable? And if it isn't, what are you going to do to try and fix that?
We've recognized this has been an issue in the north as cases started to take off again a few weeks ago. It is something they're trying to address. It's not an easy question with all of these things. Once surge capacity is exceeded, it's hard to continue to build up the resources that are needed. But it is something we're looking at, how to make these more easily accessible in more places and to ramp up the capacity for testing. It's been a challenge in some other communities, but particularly, as you say, in Prince George and in some of the other smaller communities across the north where cases are surging. The bottom line is if you have symptoms, important to stay home. Yes, get those tests as soon as you can, and we will be working with Northern Health to make sure we're already in the process of trying to ramp up the testing again.
Caden, do you have a follow-up?
Just what is the message to local leaders here? Obviously, there's plenty of rural communities, especially that are unvaccinated, or, well, for the majority, unvaccinated below the rest of BC. Many of them are feeling a bit of defeat right now as, the holdups continue. Has the messaging changed? Is there anything more that they can do to get people vaccinated that are holding out right now?
I think that's a really good question. And we had really great meetings led by the minister last week with a number of leaders across the north. And this is a challenge. How do we put that positive information out there? This is not something to be defeated about. This is something that we have the agency. We know what we need to do to address. One of the important things is answering people's questions, making it available, making it convenient for people, and we're doing everything we can to do that. Addressing some of and I talked a little bit about this last week, the misinformation. So that's when things are a little bit of truth and then it gets twisted a little bit. Some of the things that I hear a lot are people wanting to have exemptions because they're immune compromised or because they have autoimmune conditions. These are all reasons to be immunized. And so having the people's questions answered in the right way, and we're trying to support physicians and immunizers and communities to be able to answer those questions for people. But also the positive experience of immunization and the fact that right now we're seeing this virus is affecting our community, and we all have the agency to work together to support each other. And as we talked about from the very beginning of this pandemic, we are all in this together. It's not about unvaccinated versus vaccinated. It's about all of us doing what we need to do to protect those we love and to protect our communities. Because what we're seeing in the north is that it is affecting my neighbor's ability to get care for whatever it is, their medical issue. And that means it's all of our business. The decisions that we make have consequences, and in some communities now, those consequences mean people can't get the care they need. It means that children can't safely go to school in some areas, perhaps. So these are the things that we need to think about as part of us getting together, working together to get through this. And Minister, you might want to add to that.
Well, I just want to express, first of all, my appreciation for mayors in the north. We have some communities. It's important to remember this if you look at communities across the north, that the vaccination rate first dose vaccination rate in Fort St. John is 69.4%, meaning the vast majority of people who are eligible to vaccinate have got their first dose immunization, and 69.4%, of course, is not high enough, but it's an indication that the vast majority of people understand and support immunization, and we need those numbers to equally in a community like Vanderhoof, which I think has the highest per capita number of cases this past week. Immunization rate is 68.3% in the community health service area in Vanderhoof, and in Vanderhoof rural area around Vanderhoof, that number is 59.7%. And Mayor Thiessen, I think, has shown exceptional leadership, as is Mayor Ackerman, as Mayor Bumstead in Dawson Creek. And all of our mayors, Mayor Hall, and all of the mayors in the region have shown great leadership, and we're very appreciative of that. And look, we have to keep going, right? Because there is one path forward, really, for communities, and that's the path of vaccination. And so we have to keep pushing forward. And remember, if your community is at 90%, you know what's better than 90%? 91% and 92%. If your community is at 68%, we have to continue to be put forward because it makes the community safer. And it's a way through this storm of COVID-19. So we are going to continue to work with mayors. I'm very appreciative of the leadership they're showing. We're making more efforts today in Northern Health to reach out to people on an individual basis and answer their questions. We're working across party lines, so you see the great leadership on vaccination shown by the Leader of the Opposition, Shirley Bond, by MLAs such as Nathan Cullen and Jen Rice and Dan Davies and Mike Bernier and Coralie Oakes and others. So we're all working together. We all see that every single time someone gets vaccinated, we all get safer. They get safer, their families get safer, we all get safer. And we just got to continue to push, and we're going to continue to do that and to support the North. I'll say this finally, that I think one of the challenges for communities is the potential and the division between people. And one of the reasons we stay positive, one of the reasons, and this is absolutely the case, that everyone gets provided care in BC. We made the decision to move some residents from Northern Health who are in critical care to Vancouver Island and Fraser Health and Vancouver Coastal Health. That is how it should be, that we support one another in difficult times, just as the North supports people in Fraser Health when challenges were there, or Vancouver Coastal Health. We support one another in difficult times. Just understand how difficult that is. People often in critical care due to COVID-19 then have to fly down to Victoria or to Vancouver or to the Fraser Health Authority, to Surrey or Royal Columbian or other hospitals. How difficult that is. And yes, we'll take you back, but that is a profoundly difficult thing, to be in critical care. And the vast majority of people in critical care are unvaccinated. And we will support you, yes, but we will not do that in a spirit of blame. But what we have to do, all of us together, is to get vaccinated, and we support all of the efforts of Northern mayors to see that happens.
Next question is from Moira Witten with the Tyee. Please go ahead, Moira.
Hi, good afternoon. Thanks for taking my question. This is from my colleague. BC CDC data shows that in Vancouver, the local health area, including the downtown east side, has had the highest rate of COVID cases for the past 5 weeks. Is public health monitoring any clusters or outbreaks of cases at homeless shelters, single-room occupancies, or any other more common living areas in the neighborhood?
The short answer is yes, we have been challenged with this for some time. It's not unique to the downtown east side. It is something that we're seeing in people who are underhoused and homeless in a number of communities around the province, both Kelowna, Kamloops, Victoria, and Duncan, Nanaimo. These are challenging issues. And Vancouver Coastal is working with all of the service providers in the downtown east side. We're making sure that people have safe places to stay, to shelter if they're positive for COVID. That has been a challenge in a way that has not been in the last year, because many of the places where people were being supported to isolate are now back in commercial operations, whether they're motels or hotels, etc. So it has been a difficult time. We're increasing. There's on-the-street vaccination and testing for people. We're supporting staff in BC Housing and in shelters to make sure that we can support people across the downtown east side and in the communities, in other communities where this is an issue. So it's not an outbreak in that it's all in one specific setting or one specific building. It's people who are across that community. There's a lot of mobility in those communities, and it's trying to support people both in the housing side, making sure they have the food and the medicine and the drugs they need so that they can safely isolate and recover. We are also seeing, as part of this is a population that's quite varied, but many people have other underlying illnesses that make them more at risk for hospitalization. And we are seeing the impacts of that in hospitals in Kelowna, in Kamloops, in St. Paul's, in Victoria as well. So it is a very difficult time, and we're working together with the community in the downtown east side and in other communities to see what we can do.
Do you have a follow-up?
I do. Thank you, Dr. Henry. Could you just clarify whether there are currently those to isolate if they test positive for COVID in Vancouver? And also, this local health area has the lowest vaccination rate of any in Vancouver. VCH did make a big effort to vaccinate people in the downtown east side, but is there a plan to ramp up vaccinations or do anything differently as we weather this fourth wave?
So I know there has been challenges, and in some cases that has meant people isolating in place, whether that's in a shelter or in their own room. And Vancouver Coastal is working with providers and BC Housing to try and get at least some isolation places for people. There is a limited number, so those who are most at risk and people who are at their most infectious stages are moving through those. So there's a lot of work being done on this, and we are doing what we can to try and increase the capacity to have people safely isolate outside of a shelter, for example. We have also already started ramping up again. We started very early, prioritizing populations who were underhoused and houseless, people who use drugs, because we know how ravaging this virus can be, and people with underlying illnesses who don't have those supports. And they have been going, whenever a case is identified, making sure that the vaccination teams are there on the ground on a day-to-day basis. So yes, we're relooking at everything that we can do to try and address this and stem the tide there.
Our next question is from Penny Daflos, CTV. Penny, please go ahead.
Thanks very much. I just wanted to start out with a question for a colleague on vaccine passports. Over the past 24 hours especially, we've been inundated with requests for help from people who've not been able to download their QR codes. Some received doses out of province or out of the country. Others received a first dose very early or very recently, and they've been told it can take up to a month to resolve the issue with their vaccine passport. So I'm just wondering, what would you like to tell British Columbians who were stressed out over the delay? And will you or Minister Dix consider a common sense extension, maybe allow people to use paper records for the next few weeks until this has been fixed?
I'm actually surprised because I've not heard a lot. We have ongoing conversations about people who are having challenges. We know that over 3-point-some million people have been able to download it. And we have a team that is there to support people. And I know there have been some that have been brought to my attention, but not a huge number. And I would encourage them to go to the vaccine card website. There's a lot of information on that. Or to phone, and I can never remember the number. It's 833-383.
1-833-838-2323.
Okay, I'm going to let you say that. We'll put the number up again. I'm sorry, but yes, call the call center. They can help you sort that out. It has been we've been able to do it within days. Early on, there was a bit of a wait period, but now it's much less. So I know there's been one of the other issues that sometimes has been led to delays is if people were immunized in other countries and their immunization data is not translated. So to come into Canada on the Can Arrive app, you need to have a translated version. So make sure you download the translated version of your vaccine record if that is one of the concerns, because I know that leads to delays.
Penny, do you have a follow-up?
I do, yeah. There are really long waits right now for COVID testing, and not just in Northern Health. We're hearing from a lot of people in Greater Victoria, Metro Vancouver, lineups from 1 to 3 hours long, and then schedule appointments that take several days in advance for other people. So will you be increasing testing capacity in the metro areas, and are you concerned that maybe you don't have a great handle on the community viral load or even how many cases we actually have right now?
Actually, I think we do have a pretty good handle on it. Yes, it's been a challenge. We have a couple of ways that we look at surveillance over time, as well as the actual testing of individuals. As I told you, in the last 2 weeks, we've seen a dramatic increase in numbers of, especially school-age children who've been tested, and that reflects the fact that there's a lot of other viruses that are causing illnesses right now as well. Yes, we've been ramping up as fast as we can. I know it was a challenge. I think I mentioned that in Victoria, in some areas around the Lower Mainland. So the bottom line is, yes, it's important to get tested. It's important to self-isolate and to stay away from others if you have symptoms at all.
We have time for one more question today, and that will be from Rob Munro with Info News. Please go ahead, Rob.
Hi, thank you for this, Dr. Henry. You post every day when the notice comes out the number of people and the vaccination status who are hospitalized and a number of cases, but you don't include ICU and deaths. And I know there is some data online about deaths which show, for example, that 3 times as many people over the age of 80 are dying who are vaccinated versus unvaccinated. Would it be useful to put that information out there so we better understand the impact that this disease continuing is having on fully vaccinated elderly people?
Yeah, absolutely, and that is posted, but it's just not. It's not the type of information that we can be accurate about on a daily basis. So that is in the weekly surveillance reports and the weekly data deck that's posted on the BC CDC website. It does reflect the age and numbers of people who are by vaccination status who are in required critical care. And I think that this is an important concept, how we look at numbers of people in critical care. It's all done by individuals reporting from each hospital every day. So those numbers go up and down a lot. Like today there were 15 people who transferred out of critical care into a hospital bed, some who were discharged home, some who were who got sick and had to be transferred into critical care. So there's a lot of flux in that. So it's not something that we give a snapshot at a point in time, but on a weekly basis, we look at those information. Those data are posted on the BC CDC website.
Rob, do you have a follow-up?
Yes, I do. Thank you. The third doses that are going to the people in long-term care, and I understand the rationale because there are shorter time periods. What about the rest of the population? I know you've talked about this before. Any idea when people in the community going by age cohorts are going to start getting vaccinated? I thought you said our third shot. I thought you said before, some maybe in January, third doses start going to everyone else.
So I think what I was trying to show with the vaccine effectiveness data that we have is that it's not when, it's if they're going to need it. So right now, we have very strong protection. And Dr. Skowronski has broken it down by a number of different things, including age group. So people over age 70 who were prioritized for vaccination, who live in the community, your vaccine effectiveness is still very, very high. We're seeing it's in the 90% range, even after receiving your second dose more than 4 months ago. So right now, there is not a need for most people in the community, for most of us, to receive a booster dose. And that's important because there are things that are changing around the virus, around the vaccine technology, and there's a lot of additional information that's being, additional studies that are going on, and work being done by the vaccine manufacturers, for example, for a smaller dose. And we've seen that in the UK, where they're giving a half dose of Moderna as a booster in some populations. So the answer is right now, for the program that we had in BC, we are seeing good, strong protection for healthcare workers who were first immunized as well, and for people over the age 70 in the community. So we're not seeing a need for a booster dose for most of us right now, and we're going to continue to monitor that as we continue to follow the studies that are being done by the vaccine manufacturers about what is needed in a booster dose in the future.
That's all the time we have for today. Thanks, everyone, for joining.